What role does head anatomy play in cluster headache pain? Imagine your head as a complex map of roads, highways, and neighborhoods, all working together to send signals. When something goes wrong, pain can hit hard and fast. That's especially true with cluster headaches. These are some of the most intense headaches you can experience, and understanding the head's anatomy helps explain why. The key player here is the trigeminal nerve. Think of it as a major highway that runs from your face to your brain. It has 3 main branches, and the first branch supplies sensation to your forehead and part of your face. When this nerve gets activated during a cluster headache, it sends a message of pain straight to your brain. This is why the pain is often focused around the eye or temple. Connected to the trigeminal nerve is a group of nerve cell bodies called the trigeminal ganglion. It acts like a relay station, passing signals from the nerve to the brainstem. From there, the signals travel to higher parts of the brain that process pain. This pathway explains why the pain feels so sharp and localized. Cluster headaches also involve the autonomic nervous system, which controls involuntary functions like tears and nasal congestion. When the trigeminal nerve is triggered, it can activate a reflex loop called the trigeminal autonomic reflex. This causes symptoms like watery eyes, a runny nose, or pupil changes on the same side as the headache. The reflex involves structures like the sphenopalatine ganglion and the superior salivatory nucleus, which are part of the head's wiring for automatic responses. Another important part of the puzzle is the hypothalamus, a tiny brain region that manages sleep, hormones, and biological rhythms. During a cluster headache attack, imaging studies show the hypothalamus becomes active. This activity might explain why these headaches often follow a daily or seasonal pattern, as if they are tied to an internal clock. Blood vessels in the head also play a role. When the trigeminal nerve activates, nearby blood vessels tend to dilate or widen. This dilation can cause the throbbing sensation associated with these headaches. It's not clear if the blood vessel change causes the pain or if it's a response to nerve activation, but both are connected. In rare cases, structural issues like tumors or infections near the trigeminal nerve or hypothalamus can mimic or trigger similar symptoms. This highlights how important head anatomy is in understanding and treating these headaches. Knowing how these parts of the head work helps doctors choose the right treatments. Medications that target the trigeminal nerve or control autonomic symptoms can reduce pain. Oxygen therapy might help by affecting blood vessel tone. In some cases, nerve blocks or devices that stimulate specific nerves are used to interrupt pain signals. So, the anatomy of the head, especially the trigeminal nerve, autonomic pathways, hypothalamus, and blood vessels, is at the heart of why cluster headaches happen and how they feel. These structures work together to create the intense, one-sided pain and associated symptoms. Understanding this helps explain what's happening during an attack and guides effective treatment options.